Welcome. Thank you for joining us today. My name is Amy Sam. I am the Health Education Project Specialist at the Maxwell and Eleanor Blum Patient Family Learning Center at Mass General. Today's program is a special collaboration between the Mass General Blum Center and Mass Eye and Ear. Before we get started, I just want to go over a few items with you all. Please note that today's session is being recorded for educational purposes. If you're interested in viewing the recording, it'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Please note that you're in listen-only mode. Everyone has mutes from here, our guest speaker today. If you have any questions for our guest speaker, you may use the chat feature, which is located at the bottom of your screen. We'll have time for them in the end. Only Blum Center staff and our guest speaker will see your questions. Please do not share any personal medical information or questions in the chat. If you have a personal medical question, please ask your doctor. Lastly, at the end of today's session, you'll be directed to a brief survey, which we'd like to ask you if it's complete. Your feedback is important to us as we plan future programs. So joining us today, we have Dr. Silas Wang. Dr. Wang is a board-certified comprehensive ophthalmologist at Mass Eye and Ear in the MGH campus in Boston, Mass, as well as Stoneham, Mass. He is also an instructor of ophthalmology at Harvard Medical School. Dr. Wang specializes in cataract surgery and also provides treatment for a variety of eye conditions, including glaucoma. He has a special interest in medical student and resident education, and in recognition of National Glaucoma Awareness Month, he joins us today to give a talk on glaucoma and eye health for older adults. So please join me in welcoming Dr. Wang.
Hello, everyone. Can you hear me okay? Thank you for that introduction. Again, I'm Silas Wang, and I'm a comprehensive ophthalmologist at Mass Eye and Ear. And I'm pleased to be here and join you today and talk about glaucoma. Let me just share my screen. One second. Here we go. Okay. Are you able to see my slide? Great. Excellent. So this talk is intended to be accessible to a general audience without necessarily any medical or scientific experience. And so I'm planning to give a broad overview of the subject matter of glaucoma. Obviously, I can't include all the details, but try to go over all the important things that I think are critical to know about glaucoma. And then I also want to talk a little bit about eye health, specifically for older adults, but a lot of the things that I'll talk about are applicable to the general population as well. And then I hope to leave some time at the end for some questions. So January is Glaucoma Awareness Month. And glaucoma is a leading cause of vision loss and blindness here in the United States and around the world. So I'll talk about what is glaucoma and how it's diagnosed and treated, and why it's so important to have regular eye exams. I'll start a little bit by just talking about the structure of the eye, just so that we know what we're talking about. So the eye works a little bit like a camera. The front of the eye focuses the image onto the back of the eye, and then which is the retina, and then the information in the image is then transmitted through the optic nerve to the brain. So the optic nerve, which is one of the structures we'll be talking about a lot, is basically like the information cable that carries the image information from the eye to the brain. In the front of the eye, in this little diagram on the right here, it's a cross-section of the front part of the eye showing the aqueous fluid, which is the fluid that fills the inside of the eye, being produced in one of the parts of the eye, flowing throughout the eye, circulating, and then draining out of the eye through part of the eye, which is called the angle. So that's kind of production and drainage of the aqueous fluid that circulates inside the eye. And this is important in glaucoma because it has to do with how this fluid is produced and how it drains and what the pressure of that fluid is. So what exactly is glaucoma? So glaucoma is an eye disease where the eye pressure damages the optic nerve. And it's important to know that you can't see any signs of it by looking at the eye from the outside. So it's not something you can see or anyone else can see looking at you. The damage to the optic nerve happens usually gradually over time, but sometimes can happen quickly. And it causes a certain appearance of the optic nerve, which we call cupping, because of the structure inside the optic nerve called the cup gets larger over time. So there are characteristic changes that we can see looking inside the eye, but we can't see anything from the outside. So how does glaucoma affect eyesight? So I mentioned that glaucoma causes damage to the optic nerve. And because the optic nerve carries information from the eye to the brain, when there is damage to the optic nerve, that can cause blind spots in the vision. And unfortunately, because we can't fix damage to the optic nerve, those blind spots do become permanent. And so for glaucoma, it usually starts in the peripheral vision or side vision. And so oftentimes, if there are small blind spots in the side of in the peripheral vision in the side, it can go unnoticed. It's very difficult for people to tell at the beginning. And so in the early stages, it can be very difficult to know that you have a problem with the peripheral vision. But eventually, over time, the damage can progress so that even the central vision is affected, and glaucoma can eventually cause blindness. So in this image here, we have a simulated image of a normal visual field, which is the way that we test the peripheral vision, and a simulated image of the person's vision. And over time, people can develop blind spots so that some parts of the image that you're looking at become missing, and eventually coming in toward the center, and although it's not shown here, eventually can lead to total blindness. It's important to know that in this kind of simulated image, the parts of the image that is missing are represented by gray spots, but people don't actually see gray spots. So this is not the same as floaters, where you see little spots moving around. These are actual blind spots where the image is just missing. But it's hard to represent on the simulation. So it looks like gray spots, but for the person who has blind spot, they're just missing parts of the vision. So if you're looking at someone's face, they're just parts of the face that are missing. And so you can imagine that even with peripheral vision loss, even if you can see the things that are straight ahead, it may affect you doing things like walking around or driving, where you rely on that side vision to know what's going on around you. So why does glaucoma happen? I mentioned something about the eye pressure. And so this is the pressure of the aqueous fluid inside the eye. And sometimes it doesn't drain well. And so that can cause the pressure to build up. So this is that same image that I showed before, where the fluid is circulating throughout the eye and then drains out of the part of the eye called the angle. And sometimes there's some kind of blockage of the drainage through the angle. And that can cause the eye pressure to build up. Or the optic nerve, which is, again, in the back of the eye, may be more sensitive to damage from the eye pressure. So even if two people have the same eye pressure, one person may develop glaucoma, another person may not, because the optic nerve sensitivity to the pressure can be different. So what kinds of glaucoma are there? So there are many kinds of glaucoma, and the main kinds that we think about are open versus closed angle, having to do with the shape of the angle where the fluid drains, and chronic, which is long-term, versus acute, which is sudden. And so there can be different combinations. There's also many other different kinds and sort of subtleties, other categories, but In general, we like to think about open versus closed and chronic versus acute. So the most common kind in the US is chronic open angle glaucoma. So in this image here on the left, um, it's a representation of the angle being open. It's not physically being blocked, but there microscopically there's a problem with the drainage of the fluid, so it can't drain out as well as it normally would. Whereas in the image on the right here, this drainage angle is physically closed. And so that's closed angle or narrow angle or angle closure glaucoma, where the angle is physically being blocked so that the fluid physically cannot even reach the angle to drain. So what are some early warning signs of glaucoma? Unfortunately, for chronic glaucoma, there are usually no symptoms in the early stages. As I mentioned, even if you start losing vision and developing blind spots, it's usually in the periphery on the edge where it's very difficult to notice at first. And there is no pain with chronic glaucoma. So by the time people notice that there are changes in vision, the disease is already fairly advanced because it's already affecting the vision in the center. So we often call glaucoma a silent thief of vision because it's silent in the sense that people may not even know that they have it, but they can be actively losing vision already. For acute angle closure glaucoma, so it's a little bit different because it's acute, meaning that it's sudden. And so people do have symptoms. They start suddenly, and they usually are pretty severe symptoms. So people with acute angle closure glaucoma generally know that there's a problem. So this is different from chronic glaucoma, whether it's chronic open angle or chronic closed angle glaucoma, which usually have no symptoms. But for acute angle closure glaucoma, it's people have intense eye pain, sometimes so intense that it causes nausea or vomiting. There is intense redness, and there's cloudy vision with halos or rainbows around lights. So usually in that kind of situation, you know that something is wrong. And so if you have sudden vision changes and sudden pain that seems to come from nowhere, um, those are definitely reasons to come in right away. And that could be to your local eye doctor, that could be to Mass Eye and Ear, to the emergency room, which we have on the ground floor, uh, to see whether it could be acute angle glaucoma or something else. So who can get glaucoma and what are some of the risk factors? So glaucoma can actually affect people of all ages, but there are certain risk factors. It certainly is more common in people who are older than people who are younger. And most of these risk factors are um, factors that are within the eye itself rather than lifestyle related factors. There are some lifestyle related factors that are additional risk factors. So those are important too, but most of the risk comes from things that are internal to the eye itself. So high eye pressure is the main risk. So the higher the eye pressure is, the higher the risk of developing damage to the optic nerve. Age, as I mentioned, is a risk factor, especially age over 60, but people who are younger can develop glaucoma as well. Family members having glaucoma, because it can run in families. It often is genetic, and people of African or Hispanic heritage have a much higher risk of chronic open angle glaucoma, and people of Asian heritage are at higher risk of closed angle glaucoma. So that's also related to genetics and the shape of the eye. People who are on long-term steroid medications, corticosteroids, like prednisone, for example, it is a risk factor for high eye pressure, which is a risk factor for glaucoma, and previous eye injuries, not a minor injury where you scratch the surface of the eye, but more significant injury where there is significant trauma to the eye can damage the structures of the angle and cause problems with the drainage. So things where, for example, being hit in the eye with the ball or being punched in the eye, that kind of injury can sometimes cause enough damage to increase the risk of glaucoma. And there are some medications that can affect closed angle or narrow angle glaucoma specifically, that don't apply to open-angle glaucoma because of how they cause the iris, the colored part of the eye, to um, change shape or dilate, which can sometimes cause more narrowing of the angle in people who already have narrow angles. There are some additional risk factors I mentioned: previous eye surgery, thin corneas, which would be something that your eye doctor could measure, high degrees of nearsightedness or farsightedness, and possibly some association with problems, diseases that can cause problems with blood flow to the eye, such as diabetes and high blood pressure, although those are not the main risk factors. So, as I mentioned, a lot of people who have glaucoma don't even know they have it, and it's about half of people may already have it without even knowing about it. So it's very important to have it diagnosed early so that we can prevent damage from progressing. And so how is glaucoma diagnosed? For chronic glaucoma, as I mentioned, there are no symptoms in the early stages, and so regular screening is essential. So seeing an eye doctor on a regular basis. I did mention that for acute angle glaucoma, acute angle closure glaucoma, there are symptoms that usually are very severe symptoms and start suddenly. So usually people do know to come in for that. But for chronic glaucoma, screening is the most important part of diagnosis. And so when you see your eye doctor to be screened for glaucoma, they will examine the eye to check for eye pressure, but that's not the only thing. So you can't rule in or rule out the diagnosis of glaucoma just based on eye pressure, because we also have to look for optic nerve damage. That's best seen with a dilated eye exam, so it's recommended to have that done. And also looking at the angle to see whether the angle is open or closed or whether there's other abnormalities in the angle. They may also do additional testing, including visual field testing, looking for blind spots in the vision, and may also take optic nerve images, such as photos or OCT scan, to look for signs of damage. And to look into the angle, there's a technique that we call gonioscopy that uses a special kind of contact lens to see the angle in more detail, to see whether it's open, closed, whether there's abnormalities there. So it's not just about the eye pressure and the vision, but there's many other things that are important to check when screening or diagnosing glaucoma. And so a lot of people ask us what is the normal eye pressure, because they have heard that glaucoma has something to do with high eye pressure. And it's true that glaucoma is more common in people who have high eye pressure, and the high eye pressure, if it is high enough, causes glaucoma. But unlike blood pressure, there is no normal, quote unquote, eye pressure that applies to everyone, that is safe for everyone. So most normal eyes have a pressure that is somewhere between 8 and 21. We measure it in millimeters of mercury. And higher eye pressure is a risk for developing glaucoma, but it's important to know that glaucoma can happen at any pressure because, as I mentioned earlier, some optic nerves are more sensitive than others. So just the pressure by itself is not a guarantee of whether you may or may not have glaucoma. And the optic nerve has to be checked to see if there are signs of damage. We also have to look at the state of the optic nerve over time to see if there's any progression over time. And so there's no single number or range that is safe for everyone. And people who have glaucoma also need to have individualized target eye pressures as well, because that can be different for different people as well. So then sometimes you hear the term glaucoma suspect. And so sometimes there are findings that are borderline or suspicious or indicate that there are risk factors. Sometimes the eye pressure is high, but there's no optic nerve damage. So sometimes there are some findings that are related to glaucoma, but not other findings. And sometimes it's the optic nerve that looks suspicious, Sometimes the optic nerve has the cupping that I mentioned earlier. Basically, the shape of the optic nerve looks suspicious for glaucoma damage. But then when we actually look for damage, we don't see any damage. And then the eye pressure might not be high. So we call these situations glaucoma suspect. And we can think of these as sort of a pre-glaucoma or borderline glaucoma situation. And many times, people who are glaucoma suspects may not need treatment, but definitely need regular testing to look for signs of damage. So then, how is glaucoma treated? So fortunately, there are many treatment options, but unfortunately, there is no cure for glaucoma. So what we can do is to slow down or stop the glaucoma from getting worse. But unfortunately, we cannot reverse the damage that's already there, and we cannot get rid of glaucoma. We cannot cure it completely. But the treatment for glaucoma to help prevent it from getting worse involves lowering the eye pressure. So wherever it is when we start out, if it's a high number, if it's an average number, if it's causing glaucoma, then what we do is start treatment to lower the eye pressure. And this can be done several ways. It can be done with eye drops, with laser, or with surgery. So eye drops, many people have heard of this. Many people know people who are being treated with eye drops for glaucoma. There are some pros and cons with every type of treatment. So eye drops are usually effective for many people who have glaucoma. Many different kinds of eye drops are available, and they can be combined as well. So if you're taking one eye drop and it's not enough, then you can be prescribed additional eye drops to get sort of an additive effect. And this is non-invasive, meaning you're applying eye drops to the surface of the eye, and you don't have to do a procedure inside the eye. But there are some disadvantages to eye drops. You have to remember to use them every day, sometimes more than once a day, sometimes more than one kind of eye drop. So you have to keep track of it and remember to use them. When you stop taking the eye drops, then they lose their effect, and the eye pressure may go back to where it was originally, and damage can resume, even if you were able to stop the damage while you were on the eye drops. So it's very important to remember to use them every day and keep track of them. They can be physically difficult to use for many people, just because, as you know, the bottles are small, the cap is small, it's difficult to aim and get the drops in the eye sometimes, especially if you have problems with dexterity or joint problems. They can cause side effects. They are medications. Most commonly, they're things like redness or dryness, but some of the medications can have effects on breathing or heart rate or other parts of the body. And you do need to keep refilling prescriptions. So obviously there's a cost with that, and you have to remember to keep going and getting refills. Laser, as I mentioned, is a different way of treating glaucoma. The treatment for open angle versus closed angle glaucoma is a little bit different for laser. So for open angle glaucoma, it's a procedure that we call laser trabeculoplasty, otherwise sometimes called selective laser trabeculoplasty. There's also micropulse laser trabeculoplasty. These laser procedures are effective for many people with glaucoma, and the effect can last for years. And so the advantage is that it can reduce or eliminate some of the need for eye drops. The disadvantage is that the effect doesn't last forever. So usually it wears off after a few years, typically 2 or 3 years. And although it can be repeated, the effect that you have tends to become a little less effective each time it's repeated. So you kind of have diminishing returns after each time. But it's what we call a cold laser, meaning that it doesn't do any cutting, but the laser energy is applied to the that angle where the fluid drains to stimulate the cells to allow more fluid to drain out without actually punching holes or cutting holes in the eye. So this is a low power laser. It's gentle on the eye, and it's highly effective for people with open angle glaucoma. For closed angle glaucoma, it's a little bit different because there's the um, angle is physically blocked by the iris. And so in order to get the iris away from the angle and prevent it from being completely closed, we do what's called a laser peripheral iridotomy or laser iridotomy, um, which helps to prevent the angle from being completely closed. It helps to prevent people who are at risk from developing acute angle closure glaucoma. And this procedure usually does not need to be repeated. It's usually a one-time procedure for each eye, but it only applies to certain situations. Technically, it's called pupillary block, um, where the iris uh, physically blocks the angle due to an imbalance of pressure in front and behind the iris, which is the most common reason for acute angle closure glaucoma. So it does apply to a lot of people with closed angle glaucoma, but it doesn't prevent other types of glaucoma. So it's not a cure-all for glaucoma. So it's still possible to develop other kinds of glaucoma, even if you have this procedure done, but it does prevent this one particular problem with the acute angle closure glaucoma. And then there is surgery as well. So typically we reserve surgery for people who don't respond well to eye drops or laser because it is more invasive. Um, there are many different kinds of surgery that are available nowadays. And so there's different techniques and different implants that can be used in order to get more or less pressure lowering. But in general, compared to eye drops and laser, surgery does have the ability to lower the pressure the most. And the effect can last for years or even the rest of someone's life. And just like laser can reduce or eliminate the need for eye drops, depending on how much pressure lowering there is. Some of these techniques can be combined with cataract surgery. So if you have cataract and glaucoma, you can have the cataract surgery to remove the cataract and also a glaucoma procedure at the same time while you're already in the operating room. So then you can get two things treated at one time. But as I mentioned, surgery is most invasive out of these treatment options. There are additional risks like infection that aren't risks with the other with eye drops or laser. And some kinds of surgery really can lower the eye pressure a lot, which is good, but sometimes there are risks of lowering the eye pressure too far, which also doesn't happen with eye drops or laser. Because those eye drops and laser are less invasive, there is not a risk of lowering the eye pressure too much, but that can be a risk with surgery. So there are pros and cons to every kind of treatment option. Typically, for someone who is starting treatment, the first line would be either eye drops or laser. Surgery would be usually something that's later on, unless, for example, you're already having cataract surgery, then sometimes it makes sense to do something for the glaucoma at the same time. So, as I mentioned, glaucoma is the quote silent thief of vision, but early detection and treatment can prevent vision loss. So I just summarized some of the most important take-home points. If you don't remember anything else from the presentation, what is glaucoma? It can cause permanent vision loss without you knowing about it. There is no cure, but treatments are available to help stop it or slow it down to prevent vision loss. But it is critical to have regular screening to detect glaucoma in the early stages so that we can catch it before it becomes a problem and prevent it from getting to the stage where you actually have blind spots that affect your daily life. And high eye pressure is the cause, but there is not a single number or range that is safe. So just the eye pressure number by itself is not enough to say whether whether you have glaucoma or if you don't have glaucoma. So I want to pivot a little bit to the eye health part of it. Unless you want to sort of address questions about glaucoma first, or we can leave that till the end.
Why don't we till the end? Okay,
perfect. So, thinking about eye health for older adults, you know, it's important obviously to think about eye health for everyone at every age, but the risk of eye problems does increase as you age. So some of the things that are age related are glaucoma, as I mentioned. The older you are, the higher the risk of glaucoma. Also things like cataract, macular degeneration, floaters and flashing lights, which are very common but could be signs of retina problems and needing depending on glasses more. So presbyopia is the condition where as the eye ages, the ability of the eye to change focus diminishes over time. And so it's common that people will depend more on glasses. Sometimes it's over-the-counter reading glasses. Sometimes you need prescription glasses. And so we do recommend that everyone should have at least a comprehensive eye exam by age 40, even if you have no problems with your vision, just to screen for some of these things. And then the follow-up after that would depend on what we find. So for example, if we find that the eye pressure is higher than average, or that the optic nerve cup is a little bit suspicious, for example, those would put you in the possibly the glaucoma suspect category, which would be worth following up on a regular basis. Or maybe if everything is normal, then perhaps you don't have to be followed up as closely, but still every few years to check for these kinds of things. And by people who are 65 and older, we definitely recommend having an eye exam at least every 1 to 2 years, oftentimes every year. So in general, what are some of the things that we advise to help keep the eyes healthy? I mentioned early detection, and obviously that's a very important thing. So I've obviously mentioned that a couple times, regular eye exams, because you don't know what to necessarily be worried about if you don't know what you have. And some of these things can be detected early at a stage where you may not have any problems. And especially with glaucoma, it's possible to take action and prevent you from losing vision. Smoking is a major risk factor for a lot of these conditions, including cataracts and macular degeneration, as well as obviously other parts of the body as well. So quitting or not starting smoking is a key thing that you can do to maintain good eye health. Protecting your eyes from the sun, from ultraviolet light especially, is important as well. It can be a risk factor for things like cataract and macular degeneration, as well as skin or eye cancers. Safety glasses, so physically protecting the eyes from accidental injury is very important. There are a lot of kinds of injuries that are very difficult to fix and can leave permanent damage to the eyes and to the vision. So if you can prevent that from happening in the first place, then obviously that is the best thing to do. Anytime that you're working with power tools, really should be considering eye protection before you start work. Diabetes and high blood pressure can cause damage to blood vessels throughout the body, and that can affect the eyes as well, causing damage to the blood vessels, especially in the retina in the back of the eye. And so keeping the diabetes and blood pressure under control is one key way to keep the eyes healthy as well. One way that I like to think about it is that things that are good in general for your cardiovascular health are also good for the eyes. Again, because the blood vessels in the retina can be sensitive to damage from these kinds of conditions. So maintaining a heart healthy diet and having good exercise and good sleep is good for your whole body, for your cardiovascular health, but also keeps the eyes healthy too. It's helpful to know your family's eye health history if possible, because a lot of these conditions can be genetic, at least in part. And so knowing what some other people in your family who are related to you, who share some of your genes, may have had, helps you know whether you're at increased risk for certain eye conditions as well, especially glaucoma, macular degeneration, these have very strong genetic components. For people who wear contact lenses, it's very important to um, follow uh, hygiene recommendations in terms of cleaning the contact lenses, not overwearing them, not sleeping with them, not doing water-related activities with them, such as showering or swimming with the contact lenses, because those things are important to help reduce the risk of infection. And sometimes an infection related to contact lenses can cause permanent scarring or even vision loss. I also want to address some of the misconceptions that are out there. There's a lot of things that we hear about that are not necessarily true or not backed by any scientific evidence. So, for example, the misconception that only people who wear glasses need eye exams. As you know, with glaucoma, you can have it and lose vision and not even know it. So, even people without any vision problems should still have eye exams to screen for these kinds of problems that can be caught early. A lot of people are concerned that wearing glasses makes you more dependent on them, especially as you get older. It's normal to become more dependent on glasses, especially reading glasses. But fortunately, wearing the glasses does not induce changes in the eyes, so it doesn't make you more dependent on the glasses. But you do become more dependent on glasses as you get older naturally because of age-related changes. So it's not because of the glasses. So sometimes people are afraid to wear their glasses and suffer from eye strain or just blurry vision, not being able to see things properly because they're afraid to wear them. So I want to reassure you that wearing the glasses doesn't damage the, doesn't make the eyes worse. We always hear about carrots or some other kind of superfood that we should all eat to improve vision or some other part of the body. Unfortunately, there is no specific, superfood or even carrots that can improve the vision. Obviously, we do want to get a good balance of nutrients and antioxidants in our diet, which is part of eating healthy, maintaining good cardiovascular health. But there is no, miracle superfood that we all need to eat in particular, to maintain eye health. It's sort of the overall balance of things that is more important than a single supplement or a single food. Now, people with macular degeneration do benefit from a particular combination of vitamins and minerals, and that has been uh, scientifically proven to be helpful in people with moderate to advanced macular degeneration. That's the AREDS 2 formula. So there are some specific situations where certain things can be helpful, but for most people, especially without macular degeneration, it's sort of the overall balance of things. We also hear about eye exercises. A lot of people ask whether doing exercises can improve the vision. Although exercise is good for the body and for the heart, unfortunately, eye exercises have never been proven to be helpful for improving the vision, either to reduce the need for glasses or otherwise. So it's good to get regular exercise for the body, but unfortunately, there are no specific exercises for the eyes that can improve the vision. Some people are resigned to losing vision as we age. As you heard, a lot of these things can be caught and treated. So losing vision is not inevitable. Unfortunately, there are some conditions that we don't have good treatments for, but there are a lot of things that we can do for things like cataract and glaucoma, which can be treated. So it's not inevitable. So regular eye exams to catch these things is very important. We often are worried about using the computer or smartphone in terms of eye health. So fortunately, using the screens the screens don't physically damage the eyes, although they can cause eye strain or dryness just from staring for long periods of time. So people can get headaches, eye strain, dryness, and discomfort. But fortunately, using the computer or the smartphone doesn't itself physically damage the eyes. And there's also a concern about the blue light from the screens. Fortunately, that also doesn't damage the vision. The intensity of the light that's coming from your screen, whether it's a computer screen or a smartphone screen, is just not intensive enough to damage the vision. So that's good news. Although some people do feel uncomfortable with the sort of unnatural hue of the blue light, and it's totally fine to wear blue blocking glasses if it helps you feel more comfortable, but you don't have to feel that it's necessary to maintain eye health. So I do have some tips on good computer and smartphone habits. As I mentioned, the screen time in itself and the blue lights from the screens don't physically damage the eyes or vision, but you can get strain from the eyes or the neck, the body just from sitting there staring at the screens for a long period of time. And the staring also causes a lot of dryness. The blue light, especially if you are exposed to it in the evening, can affect your sleep cycle. It's not damaging to the eyes, but it may cause problems when you're trying to sleep because the brain is getting the signal that it interprets as being daylight. So then some people's sleep-wake cycle, the circadian rhythm, can be disrupted. So it's important to make sure that you have the right glasses. That may be reading glasses, especially for people who are older, looking at things up close, making sure that the glasses are appropriate for you, the right prescription. Remember to blink frequently. Again, the staring causes a lot of dryness, so blinking frequently is helpful. You can use artificial tears over the counter for dryness. And we have something that we like to call the 20-20-20 rule, which is a suggestion that every 20 minutes, take 20 seconds to look at something 20 feet away, just to break the staring, get you to look around, reduce some of the strain, eye and neck strain from just sitting in one position for long periods of time. And it is helpful to adjust the brightness and contrast. If the blue light bothers you, another thing that you can do other than blue light blocking glasses is to change the color temperature on the monitor or the phone to reduce some of the blue light that's being emitted from the screen. And the positioning of your computer screen especially is important. Typically, you want to be looking straight or slightly down. The more you look up, the more the eyelids are open and the more the eyes will dry out, not to mention that it's not comfortable for your neck. So you want to be head on, straight on to the screen, looking straight or slightly down. And then I mentioned keeping the eyes moisturized. Dry eyes is a very prevalent problem, and especially with the screens, because we are staring at them for so much of the time, dryness is a major problem for a lot of people. So remember to blink, especially when you're doing something involving staring. So it's not just screens, but reading, watching TV, driving for long periods of time as well. Avoid air blowing around your face, like fans, heating and air conditioning. Sunglasses can be helpful when you're outdoors in the wind, especially cold days like today. Using the artificial tears, as I mentioned, these are basically lubricant eye drops, non-medicated, that you can get over the counter. You do want to try to avoid the redness relieving eye drops and use the drops that are just lubricant eye drops for dryness. And if you have the ability, then preservative-free artificial tears are the best option with no preservative. In the winter, in this season, the air can be very dry and humidifier can be helpful. And obviously, if your symptoms don't improve, then visit your eye doctor. There could be other things going on that make the eyes sensitive. So that's what I have for today's presentation. I'd like to take any questions. I see that there are some questions that came in through the chat.
Thank you, Dr. Wang. Let's start with the glaucoma-related questions.
Sure.
Let's see.
So let me see. I
Are
see here.
Are
Oh,
narrow
go ahead.
angles the same as glaucoma or just in the glaucoma family?
Yeah, so narrow angles are a um, feature of certain types of glaucoma. So it's some people can have narrow angles who are at risk of glaucoma but don't necessarily have glaucoma. Some people are at high enough risk that we recommend the laser iridotomy. Some people have angles that are narrow enough that it's causing the eye pressure to be high and actively causing damage to the optic nerve. So it's the narrow angle is a feature of the anatomy that can be related to glaucoma.
Thank you. You mentioned thin corneas as a risk factor for glaucoma. Is corneal erosion equivalent to a thin cornea?
That's a good question. So, for example, if you have a injury or infection to the cornea and it thins out, or if you have laser vision correction and it makes your corneas thinner, it seems that it's more related to the structure of the eye itself that when the eye was formed. So it's probably the original thickness of the cornea that is more important rather than the um, thickness that has become thin for some other reason.
Thank you. Can you briefly review some examples of the types of surgery for glaucoma?
Types of surgery for glaucoma?
Yes.
Sure. So the traditional kind of surgery is called a trabeculectomy, and basically it's a um, way of creating a shunt from the inside of the eye to um, the space under the conjunctiva, which is just under the surface of the eye. So basically, we're creating a shunt for a fluid to drain out of the eye to supplement the natural drainage. And so that really can lower the eye pressure a lot, depending on how much flow you allow. But it does have the risk of lowering the pressure too much. And because you're creating a shunt from the not to the surface of the eye, so not to the outside, but close to the surface, um, there can be a risk of infection, even aside from the surgery itself, but even down the road. But it can really reduce the pressure down quite a lot. There are also devices that can control the flow of the fluid out so that um, we try to avoid the problem of um, lowering the pressure too much. And there's a whole class of surgeries called MIGS, which is minimally invasive or microinvasive glaucoma surgery, which is a relatively new category where um, there are different kinds of devices or implants that can help to increase the drainage of the fluid, the aqueous fluid out of the eye and lower the eye pressure. So there's actually now a wide variety of different kinds of surgery, and they have different levels of risk and effectiveness. So they kind of go in opposite directions. So the higher risk surgeries are most effective, potentially have the most effect, but the most risk, whereas the lower risk procedures tend to have more modest effect, but have much lower risk. So it depends on how advanced the glaucoma is and how much we need to lower the pressure, which one your eye doctor will choose.
Thank you. And can eye drops be a treatment for narrow angles?
So that's a good question. So for narrow angle glaucoma, if it's chronic and the eye pressure is high, then eye drops can be helpful to lower the eye pressure. So it can be part of the treatment. But if there's something physically causing the angle to be closed that can be addressed or sort of reversed, then it may be necessary to do a procedure to do that. Because if there is a identifiable underlying cause for the closure of the angle, then um, you can. It makes sense to treat that underlying cause rather than just the eye pressure. So drops can be part of it, but with closed angle glaucoma, there's often some other underlying cause that can be treated as well.
Thank you. You had mentioned a little bit about, myths of nutrition foods associated with eye health. We have a question specifically regarding glaucoma. Can some foods prevent glaucoma?
Yeah, so unfortunately, we haven't found any foods that are reliably proven to help prevent glaucoma. I will say that marijuana does lower the eye pressure. So there is an effect of lowering the eye pressure with taking marijuana, but obviously that effect is not well studied, and it's not necessarily reliable in terms of the amount of effect. And obviously, it is a drug with a lot of effects on the entire body. So it wouldn't be something that you would take just for glaucoma, but it does have that effect. So it is certainly possible that there are other kinds of uh, maybe like drugs that are in some foods or plants somewhere that we don't know about that can help to lower the eye pressure. But in the as far as we know, there in the things that we would normally eat as food, um, there aren't any things that there are not any things that are known to lower the eye pressure.
Thank you. And are there any primary prevention methods to reduce the chances of getting glaucoma?
That's a great question. So, um, I assume you mean things that you can be doing on your own. And um, I guess depending on how you look at it, fortunately or unfortunately, it's usually not because of the things that you are doing in terms of lifestyle or activity or diet that cause glaucoma. Kind of like the way that eating sugar can lead to diabetes. We don't have something that doesn't that kind of situation doesn't really apply to glaucoma. Um, so there are things that are mostly intrinsic to the eye itself that are the primary risk factors. And it's in most people, it's not related to things that you do in terms of activity or exercise or diet. Um, I mean, the steroid medications, I would say, would be one thing to be aware of because they can be prescribed for many different reasons. Um, and it is a known risk factor.
Thank you. We have a question regarding where can a person get a refraction exam?
So a refraction means measuring a prescription for eyeglasses or contact lenses. So this goes, to the part where I mentioned that oftentimes people are more dependent on eyeglasses as we get older, but obviously people of all ages should um, have the proper glasses to help them see as clearly as possible. So refraction means getting the prescription. So an optometrist uh, uh, is specialized in doing refractions, and ophthalmologists can also do refractions. So in this kind of situation, pretty much any eye doctor. And when you go to see either the optometrist or ophthalmologist for a refraction, ideally you would want to get a comprehensive eye exam as well. Even though maybe you're going in just for the glasses, you should also get a, a comprehensive eye exam so you can screen for these other things as well.
Thank
So that
you.
could be at Mass Eye Near, it could be, locally. Uh, any eye doctor should be able to do that kind of exam for you.
Sure. I think we have time for one more question. Is there any time frame of interrupting the eye drops for glaucoma acceptable? For instance, this person always worry if and when someone is admitted and don't bring their eye GTTS
Oh,
with them to the
drops.
hospital. Oh, drops.
Mm-hmm.
With them to the hospital.
Mm-hmm. Yeah, that does depend a little bit on how advanced the glaucoma is. So people with mild glaucoma have a little bit more, sort of margin because the glaucoma is not progressing that quickly. People with very advanced glaucoma who can be very sensitive to the eye pressure, um, uh, can it's possible that they can lose vision in the time that they're admitted to the hospital. So it depends on how high the eye pressure is originally, um, and how severe their glaucoma is, which often but not necessarily correlate together. So the number of eye drops that they're taking often also correlates to that. So there isn't a particular time frame, although the drops are usually dosed at least once daily, but often two or sometimes three times a day. So obviously the effect wears off gradually, during that time if you miss the next dose. So it does depend a little bit on how severe the glaucoma is, how long people can go without being at risk of losing vision. Oftentimes in the hospital, even if the eye drops are not available in the hospital formulary, um, oftentimes they will allow patients to bring in their own eye drops and keep them at the bedside and use them.
Great. Thank you. So I think that's all that we have time for today. Dr. Wang, thank you so much for spending the hour with us. This was extremely helpful. And for everyone joining us, thank you so much. As I had mentioned, today's session is being recorded. If you're interested in viewing the recording, they'll be made available on the Blum Center website at massgeneral.org/Blum-Center. Thank you so much, everyone. Take care.
Thank you very much for having me.